Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, I am MD, Doctor of Medicine in Ayurvedic Medicine, that is Kaya Chikitsa, and MD in Kriya Sharir, that is Ayurvedic Physiology. We are making the serial like the TV series, that means Ayurveda in GP, Ayurveda in general medical practice. Of course, we are discussing the Ayurvedic perspective as well as the modern causes, investigations, and Ayurvedic treatments with the different prescriptions. My dear friends, today's topic is ear problems. Ear problems in general medical practice. As you know that this ear is Akash Mahabhuta Pradhan. According to Ayurveda, we must little bit understand Ayurvedic concept also. So this is Akash Mahabhuta, and there is concern of the Vayu also. So Vayu and Akash Mahabhuta, that's why we can hear, that is called as the audio or auditory nerve is starting from here and going to this part where we have the auditory centers. Actually, the ear has the external ear, middle ear, and internal ear. And the most common problem in the ear are two. Number one is the wax in the ear, or there is a tympanic membrane. And because of the unhygienic condition, because we want to remove the wax by ourselves, and we put some pointed things, and that particular tympanic membrane gets the hole, and the infection starts, and the pus formation is there. So that is called as a otitis media. कान बहने लगता है, कान से पाणी या पस आने चालू हो जाता है, that is called as a otitis media. मराठीमध्ये आम्ही कानातून पाणी यायला लागलं, कानाला वास मारायला लागला, असं काहीतरी शब्द वापरतो. Okay, so I am talking in English, Hindi, Marathi as and when possible. Okay, so this is the wax, then the otitis media, and the common cause is a deafness, which is many times it's very difficult to cure. But we are going to discuss all these things. But here I want to tell you, we have to take prevention is better than cure. We have the specific protection of the ear by protecting ourselves from the very loud noise. Nowadays, there are a lot of festivals in India, starting from the Ganpati to Diwali to the New Year, and there are DJs and the big walls of the high sounds, and that can cause your damage to the your ears. Basically, there is a damage of organ of Corti. In the internal ear, there are specific cells, and that cells, when they are destroyed, you get the problem of the hearing. So, my dear friends, this is very much important. You have to protect from the sound pollution. Prevention is better than cure. Once you get the deafness, it is very, very difficult to cure. And second important thing, as I have mentioned, this is concerned with the Vayu and Akasha Mahabhut. Ayurveda has said in the Dinacharya daily routine, but you can do at least in a week or at least in fortnight or on the holidays, putting the oil in the ear. And that particular procedure is called as a Karna Purana. Karna Purana is very, what you can say, the nourishment to the ear, all the parts of the ear. So Karna Purana is a typical method of putting Tilataila or the Narayana Taila or whatever your Vaidya has suggested, but putting the oil over here, lying on this part, and then after 15 minutes you have to remove the cotton, again put it over here and lie down on the right side. But Karna Purana is very essential. Simultaneously, as these are the Vayu and Akash Mahabhut, your diet should be very nourishing. It should not be total dry. Because if the Dhatu Kshayjanya Vata Prakop takes place, if the deficiency of protein, carbohydrate, fats, or Ayurvedic Sapta Dhatu, then there can be the problem with the ear. Vata Prakop is the main reason to get the problems in the ear. So let us start to discuss ear problems in GP. The video may be little bit, of course, some videos are definitely big because these are the educational videos to make the knowledge for my, what you can say, the young generation of the doctors, then the students of the medical field, and also the what you can say, the professors and the common people who want to gain the proper knowledge. They don't want just gimmicks of 1 or 2 minutes making the reel and short. That is something another compartment that I also make, but that is for fun. But if you want to really educate yourself, then you have to see this video till end, and don't forget to subscribe my YouTube channel to get such fantastic educational but simple language videos from Professor Deshpande. Okay, first is a problem of wax, then furuncle of the external ear. That means here we have some hairs, and in that hair root there is an infection of the hair follicle, which is called as a furuncle of the external ear, which is very, very, very painful condition. Then otitis media, just now I have discussed some water and pus is coming from the middle ear to the external ear through the tympanic membrane by putting the hole. So that can be, but that infection should very well be treated. You may treat it by allopathy, Ayurveda, homeopathy, but 100% it should be treated. Otherwise, that middle ear infection can reach to this particular bone. Remember this, this is called as a mastoid bone. And then if that bone is get affected, it is called as a mastoiditis. And the most dangerous part, if that bone is infected, the infection can go to the brain also. And then the meningitis also occurs, which can be sometimes fatal. So be careful. Your infection, ear infection is not all the time very easy. It has to be 100% cured. If the partially cured, then infection, ear infection can spread to the bone and from bone to the brain. And brain is a meningitis that can be a fatal problem. Let us start to discuss otitis externa, then fungal infection of the external ear. Now I am talking about wax. It is usually a secretion of two glands. Here we have glands which are very minute, sebaceous and ceruminous glands. The normal secretion of the sebaceous gland, here also we have the sebaceous gland. That's why we get the problem of the acne, okay, blocking of the sebaceous gland. Here also, in the ear also, sebaceous gland, they secrete some material like cheese kept in solution by secretion of ceruminous glands. If the fluid portion, that means fluid portion evaporates or become less in amount or gets destroyed, thick wax is formed. So this is a normal protection mechanism, the gland secretion. But something in coordination occurs, then there is a thick wax is developed. So what is the treatment according to Ayurveda? The local application, as I have said, Karna Purana is a prevention, but you can have the Karna Shula Hara Taila, then Lashuna Taila. This is or, not all the time at a time. Lashun is from garlic, Tila Taila, simple sesame oil, or Vrishchika Rasona Siddha Taila, which is very, very rare to get it. Some Vaidyas, they may prepare. Remove the loose wax. First, you have to put the oil, and when the wax get loosened, by typical procedure, that procedure is very crucial. You have to learn it from the doctor, family doctor, and then because you have to put a typical instrument called as a vectis behind that wax, behind, and then you have to take it out. If you just put that Johnson and Johnson bird and try to remove, sometimes that wax will go inside, and that can be the big problem. So if at all there is a problem, you please visit to the ENT surgeon that he may do syringing of the ear. That means water jet is flowed, is inserted, water jet, and then because of that water, some the wax is coming out, and that typically by using what I can say the wax hook, the particular wax is removed. Next, we will go for furuncle of the external ear. It is a staphylococcal infection of the hair follicles in the cartilaginous portion of the external canal. This is the external canal, okay? Predisposing factors which can cause this infection. Number one, trauma by pricking. As I have said, some sharp instruments, if you are using for just removing the wax, that pricking itself is a chance of infection. Then soddening of skin due to swimming. Some swimming pools where or some rivers or wherever you are going for swimming, that particular water may not be very hygienic or purified. And last but not least, regarding the any infection, fungal or bacterial infection, you must check your blood sugar level. And especially if the patient is diabetic, check the blood sugar whether that diabetes is under control or not. If diabetes is not in control, any bacterial or any fungal infection will not be get cured. So mind well, your blood sugar should be normal. Okay. Then what is the Ayurvedic type of antibiotics? Gandhaka Rasayana from Ayurveda Rasashala Pune, 1 tablet 3 times in a day with Sukshma Triphala. I personally feel that this twin is a pair. Gandhak Rasayan plus Sukshma Triphala is always working like a modern antibiotics, especially broad spectrum antibiotics. So definitely you can try for it. 2 tablets 3 times in a day. And then there is an analgesic in Ayurveda, Vatari tablet, 1 tablet 3 times in a day. Now we will go further. otitis media, that is a water and pus discharge from the middle ear to the outside through the tympanic membrane. There is a hole. We can check by some speculums or the light. We have some doctors have the headlight, and then they put the speculum and they can see inside till the tympanic membrane. Okay, so acute suppurative otitis media. Suppuration means pus formation. It is an acute inflammatory सूजन आ जाती है condition of the mucoperiosteal lining of the middle ear cleft. It is common illness in the infants and children, occurring more often during the winter season and usually secondary to upper respiratory infection. That means that particular child may have the cold, cough, flu, influenza, pharyngitis, laryngitis. So all these symptoms are there, and we have the one tube connecting to my throat and the ear. So the infection passes from that eustachian tube into the middle ear. Are you getting my point? So upper respiratory tract infection can be the predisposing factor. Now, sources of infection: extension from the nasopharynx, enlarged and infected adenoids like tonsils. Okay, then tonsillitis, then rhinitis, watering from the nose, sinusitis, then the pharyngitis, infection of the throat, coryza of measles and whooping cough. By this, you reach the infection to the middle ear. From external ear also, infection can reach. Traumatic perforation due to the blast, like fighting, then the foreign body. Reinfection from previously perforated drum. What is drum? Tympanic membrane. In between external and middle ear, there is a diaphragm. Then fracture of the temporal bone. This is also one of the rare cause. Now investigations: ear pus culture. You can send that particular pus to the pathological laboratory to find out exact organism and exact antibiotic according to the modern science. That is called as a culture and sensitivity test. Okay, CNS. But in Ayurveda also you can do this test. Sukshma Chaturbhuj Rasa, Kafagna type of treatment, 50 milligram plus Rasa Sindur 50 milligram, which both the drugs are Amapachak. According to Ayurveda, this pus or the pathological secretions are considered as a Ama. Toxins created by bacteria or fungi or viruses, according to Ayurveda, they are labeled as Ama. Remember this word, okay? So these all the dravyas are taking care of that arm, destroying the arm. That is antibiotic. And also Kafadina, Septilin tablet from Himalaya, 2 tablets 3 times in a day. This is one prescription. Or otherwise you can use this one also, Gandhak Rasayan, 2 tablets 3 times in a day, plus Vyadhi Harana Rasa, 50 milligram. All these herbo mineral products, better way, I will suggest you can use like a Baidyanath company. Because if you go on haphazardly and purchase anything, if the metals are not properly purified, that can create some problem. Okay. So Vyadhi Haran Ras 50 milligram, because these are very strong. Rasa Sindur 50 milligram, mixed it with the honey, and 3 times you can take the chatan with the warm water. Then another prescription. Dr. Deshpande is giving a lot of variety of medicines and variety of prescriptions. But that will doctor will decide which is good for which patient. Okay. Then Kapardik Bhasma, 100 to 500 milligram. This is a Kashaya Rasatmak and absorbs the excessive watering. 2 times in a day, also for instillation. That means, but it should be done not by the patient. It should be done by doctor if he feels okay. Otherwise, it is said by the modern doctors that whenever there is a pus, whenever there are the secretions, please, please, please don't put any drops, any powder into the ear. I personally also feel that although in the Samhita Granthas, it has been mentioned sometimes, put some powder, but that should be the responsibility of that particular Ayurvedic Vaidya. Okay. Then next is a Karna Strava Haratail, Ayurved Seva Sangha Nashik. Karna Strava. Strava is a discharge. Har, to nullify that Strava for local application, putting the ear drops. Then Sarivadivati orally. It is again Pittagna. It will reduce the inflammation. It will purify the blood. Sarivadivati Anantamur, purification of the blood. 1 to 2 tablets 2 times in a day. Next prescription, my dear friends, for otitis media. Sarivadivati, 2 tablets 2 times in a day. Tribhuvana Kirtiras, very famous for upper respiratory tract infection like cold, cough, fever. Tribhuvana Kirti, traditional Ayurvedic medicine, 2 tablets 2 times in a day. Guduchi Sattva, Guduchi Tinospora cordifolia, the best immunomodulator. It will improve your immunity and also blood purifier like antibiotic. 1 to 2 tablets 2 times in a day. Regimen, what are the do's and don'ts? Plug in cotton, put some cotton, very sterile cotton, and change if it wets due to the pus. Change every hourly, every frequently. Try not to use any eardrops unless indicated by specific Vaidya. Don't do it by yourself. Do not wet head while bathing. Don't take the shower from the head. Next is a condition which is called as a chronic suppurative otitis media. First was acute. The long-standing infection of the middle ear cleft is known as chronic otitis media. When the discharge is purulent pus, it is known as a chronic otitis media. Now, which are the predisposing factors? What are the reasons why this is happening? Neglected and improper management of acute infection. Because many slum areas, poor people, what they do, take only antibiotic for one day. And because they don't have any money, because all the allopathic antibiotics, even Ayurvedic medicines are costly. I'm not saying only allopathic, but many simple antibiotics are costing 10 rupees plus. And one has to take this tablet 3 times in a day. So nearly 40 to 50 rupees only for antibiotic per day. It is something, some people, they have the problem with this. Otherwise, they should go to the government hospital, what I will suggest. Because the treatment is very important, don't bother about the money matter, because antibiotic should be taken as and when necessary. So go to the government hospital where there is a free medication. Okay, dosage of the antibiotics was inadequate or discontinued early. As I have said, antibiotics should be taken for minimum 3 or 5 or 7 days. If the patient takes only 1 day and stop, then that infection is not cured 100%, and that remaining will go for the chronic. Recurrent infection from primary focus in the neighborhood, that is infection from the nose, nasopharynx, tonsils, paranasal air sinuses or adenoids, all these infection remains there and they enter into the ear. High virulence, that is the patient having low immunity, low resistance. It may be because of chronic illness, like patient may be suffering from cancer, tuberculosis, HIV, so diabetes, then that can be the hurdle to get 100% cure, and the disease from acute, it turns to the chronic condition. Okay, certain infection which is chronic from the very beginning, like for example, if the patient is suffering from syphilis, this is a sexually transmitted disease after visiting to the prostitutes or the social sex workers. Tuberculosis, otitis media with acute infectious fever such as the measles, whooping cough, this can become a chronic in nature. Poor economical conditions and unhygienic surrounding is also one of the cause why these infections are becoming chronic. Now, treatment, very simple. Use all the medicines prescribed for acute otitis media. Use the medicines for primary infection. Refer the patient to the specialist, that is ENT surgeon. If perforation for long term, and then you have to treat it by myringoplasty or mastoid operation. That is a requisite at some time. So in chronic cases, don't take the chances for treating long time without specific results. Be careful. Otitis externa, external ear, and inflammation of the skin lining of the external ear. What are the causes? Traumatic, following pricking or the soddening of the skin by swimming in the bad water. Allergic dermatitis, this is very important, allergic. Then Sutta Shekhar tablet, which is a Sama Pitta tablet, which take care of the Pitta with inflammation, Pitta with Amata, Pitta with toxins. Then that is called as a Sama Pitta. And for Sama Pitta, Sutta Shekhar is the best tablet. 1 tablet or 2 tablets 3 times in a day. Then Sukshma Chaturubhuj Rasa, 100 milligram 2 times in a day with honey. Local application of Shodhana Taila as a eardrops. Okay. Next, application, because we are talking otitis externa. Then fungal infection of the external ear. wipe off external ear with spirit swab and dry with cotton. For local application, Vrana Shodhana Tail, you have to apply it with the cotton swab. This is or Paribhadra Tail, that is prepared from the Nimb, Azadiracta indica, that is antiseptic. Or you can apply Isab Gajakarna Malam. Malam is ointment in Ayurveda. What is, sir, HP? Hari Parshuram Aushadhalaya, the pharmacy of Khadiwale Vaidya from Pune city, Maharashtra state, India. That has to apply 2 times. Then blood purifier or Ayurvedic antibiotic type of tablet, Thiostanin is available, blood purifier. That is from Ayurved Rasashala company, Pune city, Maharashtra state, India. 2 tablets 3 times in a day. Maha Manjisthadi Kwada, that is a blood purifier. 4 teaspoons with equal amount of water 2 times in a day. That is all for fungal infection. Now we will go for tinnitus or the deafness. Bilva Tail, very specific herbal plant which is having best results for tinnitus or the deafness also. 2 drops in each ear, then a Karna or then is Karna Bindu, 2 to 4 drops in each of the ear. Then internally also you can take Sarivadivati, 1 to 2 tablets 3 times in a day. Mahavata Vidvamsana Ras, 1 to 2 tablets 2 times in a day, because that is controlling the Vata. Because this particular is indicating there is excessive dryness because of the Vata dosh or excessive Chalaguna of the Vata dosh. To control Chalaguna and to control the dryness, we are putting oil and we are also giving inside medicine. Especially this Vata Prakop is again more over times Dhatu Kshejan Vata Prakop. Okay, Guduchi Sattva to build up your immunity, 1 to 2 tablets 2 times in a day. So my dear friends, this is all for today's lecture or the information regarding the ear problems in general medical practice. I think you are liking this video and making a good support for me. So one support I am expecting. Please don't forget to subscribe my channel and press the bell button icon to get such a fantastic videos, scientific language but simple language by Professor Deshpande. I wish all the best. Take care and see you in the next video. Thank you.